Good morning. Today is Saturday, September 11, 2021. This is our regular Saturday morning yoga therapy class. But today's class is very special. Today's class is designed for the continuing medical education program, which we are hosting this weekend, September 11 and 12. This is called an overview of yoga therapy for the healthcare providers. We have been doing this program for last 11 years. We do it twice a year in May and in September. We've been doing in person live all these years except the pandemic time. Now we are all virtual, and people who has registered for the continuing medical education, they can join this session and they will get the extra credit hour of continuing medical education. Today is also September 11, one of the darkest days of American history. This is a 20th anniversary of September 11, 2001, when America had the worst terrorist attack and with the loss of 3,000 American lives. So before we start the program today, please take a moment of silence to honor the people who lost their lives and for our prayer for their soul to rest in peace. Close your eyes for a moment of silence. Slowly open your eyes. So today's program is Transformative Power of Yoga Therapy. So what does it mean? This is also primarily for healthcare providers and also for people who are practicing yoga therapy regularly, and also for the yoga therapy teachers. What we have done for our continuing medical education program, we have shared our experience, we have shared all the research, and also we have shared all the contents from the true yoga scripture. And once we started sharing our experience and our research work, what we found that with a regular practice of yoga, people do develop few transformative changes. Number one transformative change is your reduction of the pharmaceutical support. If you are a daily or a regular practitioner of yoga therapy and you have an underlying chronic lifestyle related disorders, we have seen that the number of medications you are taking, that starts to go down. No question about it. Number two, what do we see? Just 1 second. What is this? Number two, what do we see? After reduction of the pharmaceutical support, you have a slow progression or even the reversal of underlying lifestyle related disorders. Example being coronary artery diseases, hypertension, diabetes, truncal obesity, what you basically call a metabolic syndrome. Third, we see better quality of life. People do enjoy a better quality of life, and they're functional. In a transformative power, what you find out, what you need, a basic yoga practice to transform yourself. Yoga language in Sanskrit, we said, we transform from a rogi. Rogi means people who have a disease, to nirogi. Nirogi means people who does not have any disease, who are healthy, and to a yogi or yogini, that means people who are enjoying a good quality life. As you all know, and you will be seeing more if you're joining for the CME program, Continuing Medical Education program, you'll be seeing we'll start from the basics, like what is yoga. Yoga, the word yoga is a anglicized version of the Sanskrit word called yog, which means a union of your body, mind and spirit. It's a philosophy called Yoga Sutra of Patanjali, 196 sutras or small aphorisms, of which 193 is to quiet down your mind. Practice is called 8 limbs yoga, called Ashtanga yoga, called Yam, social restraint, Niyam, personal restraint, Asana, external and internal alignment, Pranayama, voluntary regulated breathing, Pratyahara, control of your 5 senses, Dharan, the focus, Dhyan, the meditation, and Samadhi is a union of your body, mind and spirit. During the practice of this yoga, yoga was infused with other complementary practices like mudras, bandhas, kriyas, philosophy of Ayurveda, and it became what in Sanskrit called Yoga Chikitsha or yoga therapy. Yoga therapy basically, as a definition or defined in a very short, we call it description, is the adaptation of the yoga practices based on the patient's or client's underlying medical condition. You as a yoga therapist, you will understand and realize this is the patient who has underlying this chronic underlying medical condition, and how to approach. If they have a a physical ailment like a back pain, shoulder pain, knee pain, neck pain, you start with the gentle relaxation responses. If they come with a breathing problem, breathing tissue, still start with first with relaxation responses. Then you pay more attention to their breathing, the voluntary regulated breathing called pranayama. If they come with a neuropsychiatric disorders, you try to start doing a quieting down your mind. It's called a chitta vritti nirodha. So first of all, let's start looking at our experience. What is our experience says how to start a transformative yoga therapy practice for a patient with underlying chronic medical diseases. Okay? The first and foremost, a person who has an underlying medical condition, they are not able to sit down in the ground, not able to sit properly, and you always see their posture is not correct. Let me show you a little bit what I talk about posture and how to correct the postures. Just give me 1 minute. I was going to show you a special chair for your posture, what is called your a kneeling stool, but I'll show it a little later. Okay. The first, let me explain another observation what we have. We have a friend of ours who have been observing people who are sitting down. People who are sitting down having a higher incidence of lifestyle related disorders, like people who are the IT, information technology people, sitting in a chair, they're hunchback, they're looking at the screen all the time. They have a lot higher incidence of metabolic syndrome, diabetes, hypertension, coronary artery disease, truncal obesity, dyslipidemia, high cholesterol, you name it. Now, to correct that, they started one which is called a standing desk. You stand up and you work on a desk. There was another called moving desk, like you stand on a treadmill and treadmill goes very slowly, you're walking and you're working. But none of them took off the ground. People are still sitting. So her name is Joan Vernikos. She wrote a book called Sitting Kills, Moving Heals. Then what was our observation is people are sitting down, they're going to sit down. Then you say, okay, do 20, 20, 20, like for your vision, 20 minutes, look at 20 feet away for 20 seconds. All these things being taken, then we looked at the basic yogic phenomena. Basic yogic phenomena is the keeping your spine straight. What does it mean by spine straight? What does it mean the spine straight is? One of the a statement from the scripture of yoga is you are as young as the flexibility of your spine. So think about rationally. If we don't have any muscles or anything in our body, if you have a skeleton, if you put the skeleton standing up, the skeleton will fall in the front because of the weight of the head. So what is our muscles? These are called paraspinal muscles, muscles on the side of our spine. The muscles are contracting to keep us erect, straight. So the muscles are contracting so hard, so long, that they're keeping the spine at a, we call it a splinting. The spine is rigid to keep it straight. And that contraction of the muscles are generating a fight and flight response, which is called a sympathetic overdrive. So our observation is that if we have to start with a transformative therapy or transformative power of yoga therapy, you first and foremost incorporate how to keep your spine straight. Absolutely properly indicated. Step by step in a daily practice. Wake up in the morning. First thing we do, as being practicing for a long time, we first sit down in a squatting pose called malasana. In a squatting pose, we keep our spine straight. We keep our hands together, separate our elbows, and we stay in that posture with the spine straight for a long period of time. And I have shown it to you many, many times that initiates a relaxation response. You have a proper bowel movement first thing in the morning. And you start with keep your spine erect. The moment you keep your spine erect, what happens when you consciously keep your spine straight? The paraspinal muscles on the side of your spine, which was contracted, which felt like a piece of brick, now it will feel like a piece of pillow to you. Next you'll be able to get up from sitting down to a standing position without a support. It's called a sit-rise test. In a sit-rise test, there is a lot of research. There's a Brazilian cardiologist who has looked at over 3,000 patients. If you can transfer yourself from sitting even to the ground and getting up without a support, that is a sign of transformative health, almost equal or better than even cardiac conditioning or cardiac workout. Then what we do, we get up, stand against a wall. Let me see if I can show it to you. I'm against a wall and so I'm in front of a wall. The wall is behind me. I will stand first. First, I will touch the back of my heel. Then my hip will touch the back of my wall. And slowly I push myself back. I will touch the shoulder with the wall. Then I will touch back of my head. Keep my face straight. My whole body is touching the back of the whole wall. Slowly I'll get up, put my hands all the way high up to the wall, and I will stay here. I'll have my eyes closed. Now I incorporate my breath. What is the power of breath? Lung is like a balloon. It has a 6-liter capacity. It needs 1.5 liter to keep it open. We have a 4.5 liter which you can exchange. Breathe out first, empty the lung. Take a deep breath in. Breathe out longer than breathing in. I will stay in this posture between 5 to 10 breaths. Slowly I'll put my hands again on the side, in the wall, almost like I'm doing a savasana in the wall. Put my hand over my head. Slowly I push my hand all the way to the back, but my whole body, back of my body is touching the wall. Eyes are closed. I'm breathing out longer than breathing in. Breathing out, exhalation is parasympathetic, inhalation is sympathetic. All the muscles starts to relax. Muscle cannot contract it too long. When the muscle is contracting and you are in the posture, we call it asana, which is alignment, then slowly and slowly muscle starts to relax. Before the muscle starts to relax, it causes little called fasciculation. Fasciculation means this is like a twitching of your muscles. When the twitching goes away in relaxation, it is called sthiti. Sthiti means your stability. I'm stable. When the muscle contracts in a asana, it's called arambha. It's the beginning. Stay in the posture a little longer. It's called your sthiti. Then it's called a visarjan, profound relaxation. So look at the steps. Get up in the morning, sit down in a squatting pose called malasana. Keep your spine straight, drink a glass of water, have a bowel movement in the morning. Put yourself, during the morning practice, put yourself against a wall. Keep your body exactly touching the wall from your head down all the way up to your back of your feet, back of your heel, and do a longer exhalation than inhalation, at least 5 to 10 times. Within a short time, you will see the changes you are going to have. And now let me tell you our observation. See, we're sharing our observation and sharing our research because we have hundreds and hundreds and thousands of patients who got better. First, if you do any yogic practice, and if you look at through a parameter, Rajan today in the CME, he will talk about measured yoga therapy. We have all of your health parameters like a Apple Watch, then your Fitbit, you have plenty of health monitors. You will see there is a physiological changes exactly right away. You do a Bhastrika Pranayama, you do Anulom Vilom Pranayama, alternate nostril breathing, or you do a spinal rotation, or I would do a called prayer pose to the back. You'll see there is a changes. Your blood pressure going to come down, heart rate going to come down. If you look at your channels called the nadis will get aligned. So we know the thing happens. And we're not telling you that we read in the book. This is our personal experience. Then what happens, if you keep on doing it regularly, and regularly basically we say it's a daily practice. It's not 3 days a week, not 5 days a week, it's a 7 days a week, a regular timing, preferably in the morning in an empty stomach. Because that's called a daily routine, dinacharya. Dinacharya is a part of yoga therapy. If you keep doing it daily, it takes about 20, 30, 40, at least a 40 input. 40 input means that if you keep on doing after 40th time, your brain develops a phenomena which is called the neuroplasticity. Neuroplasticity, basically, you can say in our plain English, is a habit forming. If a habit forming, the neuroplasticity will allow you to able to sit down with your spine straight, able to stand against the wall with your spine straight, able to sit down with your cross-legged. That is your neuroplasticity. And let me share with you another fascinating phenomena. A fascinating phenomena is that when the neuroplasticity sets in, and we've seen in the people, don't ask me why, they become non-compliant. They feel good. The blood sugar is down, blood pressure is down, truncal obesity is coming down. Suddenly one day we see, hey, it looks good. They stop doing it. The compliance goes down. When they stop doing it, then our observation is, that is another fascinating observation. Once you have a neuroplasticity sets in, it takes about almost 4 to 6 weeks for the effect last before it goes away. There is studies done who show that you have people with asthma, people with diabetes, people with hypertension. After a proper yoga therapy, they have shown a good results, both functionally and with a measured therapy. Then they stop doing it. But the effect of that yoga therapy lasts not a short time, 2 weeks, 4 weeks, sometimes 6 weeks. But what we also know, essentially it goes away. So what we hear from the people who have been practicing and they stop doing, you see, I'm not flexible anymore. My breath is not that effortless anymore. I cannot keep my eyes closed and be in a meditative state much longer. So coming back, you are a yoga therapist. Patient came to you with a underlying chronic lifestyle related disorders. How you're going to approach? First approach is you tell them, sit down in a chair. I'm sitting in a chair. Actually, I'm not in my house. I'm out of town. I don't have that usual my practice area. Today we'll be doing this CME program. So I said, yes, I will do sitting in a chair. I am sitting in a chair. Now, how do you sit in a chair? You sit in a chair, if you're sitting in the front of the chair, you will keep your spine straight. For me, I have a mirror on this side, and I'm looking at the mirror, and in the mirror, I'm looking at my whole back is straight. Keep my legs grounded and just keep my eyes closed, and I'll slowly bring the power of breathing, the longer exhalation, which is parasympathetic, to create the relaxation response. Remember, all the lifestyle related disorders today are due to high sympathetic overdrive. What is high sympathetic overdrive means is called your stress. The stress is the activation of the limbic system, the emotional part of the brain. Two nuclei, amygdala and hippocampus. Same way, you want to be a little comfortable, go to the back of the chair. I'm in the back of the chair, but I keep my spine straight. I'm sitting down with my spine straight. No question asked, nothing, I'm always, wherever I'm sitting down, in fact, when I am working in front of my computer, I have a stool, special stool called a kneeling stool, which I have shown it to all of you before. In the kneeling stool, you will see my spine always remains straight. No way you can keep it. So, coming back to the original statement, which is saying, sitting down, sitting kills, moving heals. You cannot get the people out of the sitting. IT people are in front, and then these days with the virtual thing, you're always sitting in front of your laptop, in front of your computer, in front of your mobile phone. But what you can do, sit in the front with your spine straight. Your keyboard should be at the level of your hand where you can type it without bending your spine. Let me give you another observation. If you see a 90 years young, 100 years young person, we never say old, they're young, 90 years, 100 years, you'll always see their spine is straight. They will have a straight spine. When you get a hunchback, people with a hunchback spine don't live that long. My grandfather was 6'4". He lived a long, long time. But whole life I've seen, he is absolutely straight. His spine was absolutely straight. You are as young as the flexibility of your spine. You are as healthy as the flexibility of your spine. I really don't want you to do anything, nothing in the yoga therapy for the transformative changes, but to incorporate keeping your spine straight throughout the whole day and night. People who comes to me, I said, I have a musculoskeletal disorders. I have a serious back pain, it's not going away, hip pain, neck pain, all this. I said, answer is very simple. Sleep on the floor, sleep on a hardwood floor, even maybe sleep on the carpet. And I have tons and tons of evidence. Recently, one of my friends, is a family, actually her wife was having a serious back pain, and they were making a long overseas trip, and said, what we can do? I said, sleep on the ground, sleep on the floor. The moment you're sleeping, remember, sleep, all the muscle relaxes, and then you have a soft mattress, your spine bends. The moment spine bends, the muscle tightens up again. The flexibility spine is gone. exhalation longer than inhalation, spine straight, period, no question asked, end of the therapy. Transformative power of yoga therapy for chronic lifestyle related disorders. Keep your spine straight throughout the whole day. Practice breathing out first, breathing out longer than breathing in, and within a short time you will develop neuroplasticity, and that's how we are going to breathe even you are sleeping. We don't need no this asanas for diabetes, this pranayama for diabetes. Yes, we'll do it. We do it all the time. But let's do this thing. Money back guarantee. If you don't have any result with this, please call me. Come and talk to me. Because we have thousands and thousands of people who got better with this. What else we incorporate? Yes, we incorporate a lot of other yoga practices. We say, we'll talk about today, not to get today and tomorrow. We'll say complementary practices during our CME program. Mudras. Mudras are called the hand gesture. We call it a spiritual gesture. Mudras are called neuropsychiatric connector for the prana. Prana is your life force. Prana to go to the organ of healing. We are talking about mudras. If you are joining CME, we'll talk about tomorrow all the mudras, but the one mudra we recommend for transformative power is called Gano Mudra or Dhanu Mudra. Touch your index finger and thumb, put your palm up towards the sky and let it drop in over your knees. You cannot look at my posture from here, looking from front, but if you look from the side, I'm looking at the mirror in my side. My back is completely straight. Spine is straight. My feet are grounded. I have hands touching index finger and thumb, putting over my knees. Then I incorporate a phenomena which is called quieting down your mind. In yogic tradition, the mind is defined as a content of your five senses. I hear, I see, I smell, and I taste, and I touch. In yogic tradition is called Shabdo, Sparsho, Roop, Rosh, Gandho. Your vision. Eye is the extension of your brain. Eye is the extension of your brain which is outside your skull. Vision keeps us most awake, alert, and conscious. So he said, close your eyes. See, step by step we are going. Sitting in a chair with your spine straight, touching your index finger and thumb to doing a hand mudra. Now close your eyes. Now you bring your awareness and your conscious to your breath. You always breathe through your nose. Do not breathe through your mouth. God gave us the mouth to talk and to eat. So, very simple. I will show you step by step what happens when you breathe through your nostril and what you breathe through your mouth. So visualize Your air is coming through your nose. In yoga practice, always visualize that your air is coming out from your lung. Breathe out before breathing in. Breathe out, reason you are emptying your lung. Breathing out first. Visualize air is coming through your nostril. If you're practicing with me, practice it. Sitting in a chair, keeping your spine straight, touching your index finger and thumb, closing your eyes. Now, bringing your awareness to your breath. Visualize air is coming through your nostril. Your nose is like a filter. It's filtering all the dirt in the air. Your nose is like your personal air conditioner. If outside air is warm, it will cool it down. Outside air is cold, it will warm it up. Now, before I proceed further, let me tell you another very important phenomena. You'll be always doing the yoga practice based on basically two bodies' response. First body response is pain. Somebody sitting with a spine strain within a short time will say, now my back started to have a little bit of a pain. That means you have created an imbalance in your physical body. So what you will say? Fine, come off. You don't have to keep your spine straight any longer because you are going to practice based on your body signal. Remember, it is not competitive. You're listening to body signal. Yeah, okay, I have some pain, some coming off. Even I'm a little slouched now is okay. Because tomorrow it will be a little longer time. And I have been doing it for a long, long time. So for me, sitting straight is normal for me. Next thing is your breath. Your breath is not effortless. If you're sitting your spine straight, then you see your breath is having some effort. Back off. Come back again because you are creating an imbalance in your body. So no pain and with the effortless breathing. So my another request is please do not practice any yoga therapy after taking some pain medication. Do not take 2 Tylenol, do not take 2 Advil and then do the yoga therapy practice. That is not recommended. So coming back to our practice again. Now you're visualizing the air is coming through your nostril. Nostril is acting as your personal air conditioner. Then is guiding the air to the side of your nostril. If you look at the anatomy of the nose, you'll see on the side there is some groove, like a channel, which are called turbinate. When air is going through those turbinate, it creates a vortex. It's like a hurricane or a thunderstorm. That vortex of air then goes over the mucosa of the sinuses. We have all the sinuses open into the nostril, maxillary sinus, frontal sinus. When this vortex of air going over the mucosa of the sinuses it secretes a substance called nitric oxide. Nitric oxide is a potent vasodilator. It opens the blood vessels. It opens all the coronary arteries in the blood vessels, and it causes a proper endothelial health. Endothelium is the covering of your blood vessels. Today we know endothelial health is a real health. Remember, yoga therapy, basically what we're trying to do, we are trying to take care of all the underlying chronic lifestyle related disorders by tapping, by igniting the body's own healing power. Your body has your own healing power which you need to tap. This nitric oxide is also the mediator of parasympathetic tone. Parasympathetic tone is mediated through nitric oxide, cyclic GMP, acetylcholine. And you as a healthcare provider, you can think, when the blood vessels in the heart, called coronary arteries, when they go into the tightness called a spasm, due to the high sympathetic overdrive of your stress, the underlying cause of your lifestyle related disorders, the endothelium is not functioning. Endothelium is inner lining. Endothelium develops some cracks, then this endothelium starts absorbing all the cholesterol, all the calcium, every material in the blood, and started forming what is called a plaque and forming the called blockage of the arteries. When the blood vessels, especially the coronary arteries, the arteries in the heart relaxes, endothelium is functioning. Endothelium is releasing more nitric oxide, creating a profound level of parasympathetic activation, reduction of the peripheral resistance, and for the heart is a reduction of the afterload. You'll be amazed the cardiologist uses all the medications to reduce the afterload through the vasodilators. And here is a natural vasodilator because you're breathing through your nostril. When you visualize the air is then coming behind your throat in the larynx, then all the air is guided into the larynx, into your trachea, into your lung. Right lung has the 3 lobes, upper lobe, middle lobe, and lower lobe. Left lung has the 2 lobes. Air will keep going down from the upper part to the middle part to the lower part, almost to the level of your belly button. See another example. I'm in your relaxation response. When I'm in the relaxation response, look at me. I've been talking to you for so long, my mouth is still wet. When my mouth is wet, I might have a lot of saliva in my mouth. That means I having parasympathetic activation. When you are afraid, when you're fearful, you develop a dry mouth. See, and my mouth is wet. At the level of belly button, you hold your breath for a short time, which is called cable kumbhak. Then you visualize the air is coming out from the lower part of the lung, middle part of the lung, upper part of the lung, behind your throat, coming through the nostril, and air is coming out. In yogic tradition, we have a life force called prana. Prana is a subtle energy which keeps us awake, alert, alive, and prana does the healing of our body called pranic healing. In yogic tradition, it says somebody who is going to leave with this earth, who's going to die, that is called expiration. The person expired. Last breath comes out, and it says with the last breath, the prana comes out. So what happens, why the breathing is so important is that in a person who is dying, the first the breathing stops, then the heart stops, then the brain stops, then all the cellular function stops. When you improve the power of your breathing, when you have a voluntary regulated breathing, your heart function gets better, brain function gets better, all the cellular function gets better. It's an amazing phenomena. Unless you do it, you won't be able to appreciate it. Same way, sitting in a chair, you visualize. Remember, your spine is still straight, your eyes are closed, hands are in a mudras. Now we're visualizing your breath is picking up prana outside your nostril. Breath is not the prana, breath is the carrier of the prana. Metaphorically, prana is like the electricity and breath is like the electric cable. Breath is carrying the prana inside your body. Now in yogic tradition, it's not the lung which does the breathing. Our whole body does the breathing. Our liver does breathing, our skin does breathing, everything does breathing. Visualize the breath is taking the prana to the organ of healing. I have the heart disease. I visualize the prana is coming towards my heart. And prana is doing the healing of my heart. If you have a diabetes, you visualize prana is coming through your pancreas. It is helping the pancreas to release more insulin so your diabetes gets better. If you have a back pain, you visualize prana is coming through your back, healing your back. Knee pain, visualize prana is in your knee, prana is in a hip. Whatever the organ of healing, prana will do. Pranic energizing technique, pranic healing. So on that context, now you see if you breathe through your mouth, you have no idea where the air has gone. Whether the air has gone to your stomach or whether gone to your lung. But if you breathe through your nostril, air is going to go into your lung because of the turbinate, because of the vortex, because of the air is guided to the larynx. So please do not breathe through your mouth. Person comes in and says, you know what? I have to breathe through my mouth. What should I do? Okay? If you have to breathe through your mouth, then you breathe in through your nostril. Breathe out through your mouth. That is a lot more physiological. So now on your breath, now you'll see that when you relax your whole muscles, especially when you relax your muscles of respiration gets relaxed when you relax the upper part of the body. So very simple. If it's your hand, if you look at a baby, see, babies are always relaxed. If you say baby closing the hand, baby doesn't close hand like this. Baby will put a thumb inside and close. This is called a Balo Mushti Mudra or called baby fist. Balo Mushti Mudra. There are also mudras which also opens in your lung. So you touch your index finger and thumb like this and put your palm up. This is called a Gano Mudra or a Dhanu Mudra. It quiets down your mind. If you put your hands down, put it on your knees, it will be called a Chin Mudra. It opens the lower part of the lung. If you close your other fingers, keep touching and the hand down, this will call a Chinmayi Mudra. It opens the middle part of your lung. Then when you do this baby fist or Balo Mushti Mudra, they also call it Adhi Mudra, it opens your upper part of the lung. So it is extremely relaxing. In the breathing, you always open your lower part of the lung, middle part of the lung, the upper part of the lung never opens up. So when you do with the Adhi Mudra, upper part of the lung opens up, you had a better breathing. So personally, our experiential practices, we do all the asana practice, all the pranayama practice. If our hands are free, keep the hands in your Adhi Mudra. Any asana I do, if I'm doing even a Padmasana, lotus pose, I'll keep my hands in Adhi Mudra. It relaxes. So if you do shoulder reduction, relax. See, when you relax, remember the muscles of respirations are the skeletal muscles. So the most important character of the skeletal muscle is the skeletal muscle is trainable. What does it mean? Say if I'm doing a wet training, okay, I'm doing a wet training. I have a 5 pounds, I can do a 5 pounds, but generally I do it a breathing. Like what I will do, I will be breathing out first. I breathe in, then my way of looking at it, my muscles when contracting will need oxygen. So when I do this, my muscle is contracting, my biceps is contracting. So I will be here breathing out first. I will take a deep breath in, and then with a weight, I'll do breathe out. Breathe in, breathe out. Breathe in, breathe out. Then slowly I develop the neuroplasticity. From 5 pounds, I'll go to 7 pounds, or go to the 10 pounds, 15 pounds, 20 pounds. Same way as your muscles of your breathing. You will see, I'm going to show it to you now. We will be able to do, say, 4 seconds out, 2 seconds in. Slowly with the practice, we'll be able to do 6 seconds out, 3 seconds in. 8 seconds out, 4 seconds in. We'll practice so long, I can do 20 seconds out, 10 seconds in. It's all question of practice, developing neuroplasticity. So for the shoulder is a ball and socket joint. So you put your hands in the shoulder, try to put your elbows together. What you're looking for, pain. There should not be any pain. If you get a pain, you back off. Find your place of comfort, comfortable discomfort. Then you rotate the shoulder with your breathing. Close your eyes, put your elbows together, breathe out first, take a deep breath in, breathing out, slowly rotate your shoulder. Breathe in, breathe out. Breathe in, keep doing it 4 times, 5 times, as much as your body will allow. Then do opposite. Breathe in, always do balance. Remember, the whole important part of your healthy living is a balance. Okay, I'm going to share a very powerful quote with you. This is a Mark Twain's quote. Sign of a healthy living. We know all the yogic signs, but what you need to do, balance yourself. How to balance? Eat something which you don't want. Eat something which you don't want. Yoga says you put a food in your mouth, if it tastes good, spit it out. Drink something which you don't like. Do the work which you don't want to do. I do it same way. I'm a right-handed, always activate my left hand. In the morning I will use my brush and brush my teeth with my left hand. And you'll see when you start doing it, initially the brush will be all over. But then you'll see your right hand also moving like this because body has a neuroplasticity. Slowly and slowly you'll be able to do it. I use my left hand for everything. I'm wiping my table with my right hand, then I'll take my left hand to wipe my table. I have a knife and fork, if I have to use a fork, I'll with the left fork, I'm going to eat. I stand on my left foot. We do the standing poses, so activating other side of the brain to create a balance. Therapy, transformative power of yoga. So if you look at the power of your breath, take a look at it. The spine is straight, hands are in a Dhanu Mudra, eyes are closed. So let me give you a couple of examples, and if you're doing it with me, you can do it. Breathe out first. Breathe in with a count of 2 in, 1 and 2 in. Breathe out with a count of 4 out. We've been doing it for so long, so you can progress. If you can progress with me, go ahead with it. I'm going to jump the steps, so for the sake of time, I'm going to do now count of 4 in, count of 8 out. Breathe out first. Count of 4 in and count of 8 out. Very easy for me because I'm doing it. Remember, effortless breathing means you can talk, you can even sing. Now let's do where we were, 4 and 8. Count of 6 in and count of 12 out. I won't talk now. I'll breathe out first, then you will see, because it takes a little bit more concentration. So I did count of 6 in, count of 8 out. In fact, my lung is so empty now, when I'm breathing in and breathing out, I'm doing almost 2, 3, 4 times of my regular breathing, which is called a tidal volume. Okay? Count of 8 in, count of 16 out. Again, I will do the talking. I will do a long breathing out. Then I will do a count of 8 in, count of 16 out. Easily I did count of 8 in, count of 16 out. I can do count of 10 in, count of 20 out. Then also what I practice when I do the Om, I breathe out first, take a deep breath in, then you do Ah, Om, Ma, Om for a long extended period of time. I'm going to do it about 30 seconds, 35 seconds. I was in a conference. I did the opening session. I did the Om at the beginning, 3 Om. And one of my mentor, he comes and tells me, this is the longest Om I've ever seen in my 50 years of yoga practice. Because these muscles of respiration are trainable. These are called skeletal muscles. So go by the step by step again. I'm just really pounding on you as a healthcare provider, as a physician. This is not a voodoo, this is not a magic, nothing. Simple. Keep your spine straight. Spine straight. You are as young as the flexibility of your spine. You are as young as you're flexible. Rigidity is the straight line in EKG. The EKG has a spike. That is a flexible EKG. EKG has a straight line. You are rigid. And for a healthcare provider, the most important rigidity is rigor mortis. You are dead. Your body is totally rigid. Flexibility of spine. Breath. Look at me. I'm doing breathing. Breathing out longer than breathing in. It is built in my limbic system, my emotional brain, my amygdala, my hippocampus, my limbic system, hypothalamic, pituitary, adrenal axis, psychoneuroendocrinology. Breathing out longer than breathing in. Breathing out is parasympathetic, breathing in is sympathetic. Hand gesture, because remember, hand, everybody talks with your hand. In fact, hand moves before your tongue. If you see something very nice, before you can say, your hand will be like this. If you want something, put your hand before you can say, please give it to me. Your hand goes out first. So when you quiet down your hand with your touching index finger and thumb, you quiet down your mind. Quiet down your mind, which is called your stress buster. Stress is called a fear of unknown. We don't know what is happening in our life. The kids are going to school. I don't know whether they're going to have a mass shooting, so I get stressed. I'm in a plane. I don't know if the plane will hit one of the towers, in a 9/11. So I get stressed. Not knowing, fear of unknown causes stress. Breathing out longer than breathing in, then you quiet down your mind. Quiet down your mind is a breathing called your Bhramri Pranayama, bumblebee breathing. What is a bumblebee breathing? We have 5 senses. I hear, I see, I smell, I taste and touch. The content of the 5 senses are called your mind. When these this is Siri is acting up. Okay. So the content of your 5 senses is your mind. And this contents, when it gets properly processed, it becomes your intellect. It's called your buddhi. These are actually called the 5 koshas in yogic tradition. And when these contents become more processed, it becomes your wisdom. So wisdom basically is the therapy for chronic lifestyle related disorders. Wisdom means appropriate use of your 5 senses. So shut down our 5 senses. Our brain has a state of vibration called frequency. And we create a frequency called your sound of a bumblebee. 2 frequency interacts, cancels. It's called a harmonic resonance. Remember, we are a physician, we are a healthcare provider, we're a CME, we are science-oriented. We call it a evidence-based medicine, but in yoga therapy it's called evidence-based medicine plus this is called a practice-based evidence. I will be starting my lecture soon in the next hour or hour and 15 minutes, and you'll see the moment I start, I'll tell you. It is evidence-based medicine, yoga therapy, no question about it. But more than evidence-based medicine this is called a practice-based evidence. Karo yog, raho nirog. Keep doing yoga. We can guarantee you will have a transformation from rogi to nirogi to yogi. From a disease to no disease to a normal life. So the technique is you put your index finger in the forehead. You can do your own mudra called Shanmukhi mudra, but close your eyes with your fingers. Close your ear with a thumb, and then close your mouth. Shut down all the senses. Breathe out through your nostril. Take a deep breath through your nose and breathe out with the sound of a bumblebee. When I was exhaling, I was probably doing more than 20 seconds, 25 seconds. Let you do pumping and cupping. So you keep rubbing your hands, keep rubbing your hands. When you get the warmth in your hand, let's think about the physiology of what is happening. This is the warmth in your hand, putting a cup, put it over your eyes. Let the eyes take all the heat from your hand. The eyes have the muscles. Look at that. Eyes are supplied by the 4 cranial nerves. Optic nerve, which supplies the retina in the back. The muscles for the eyes, we call SO4, LR6, superior oblique, supplied by fourth cranial nerve. LR6 called lateral rectus, supplied by the sixth cranial nerve. Then the part of trigeminal nerve, which is the fifth nerve, also supplies the eyes. Your lens is tightened up with a muscle called ciliary muscles. When the muscles tightens up, lens becomes less convex. You cannot read smaller prints. With this, it relaxes ciliary muscles. Lens becomes more convex. It's almost like reading glasses. Take your hand, massage your forehead. All the muscles in the forehead, all the muscles in the face, massage your face. All the muscles are attached to the skin. When the muscle contracts, you get all the skin lines, all the forehead lines. This is called a big 11 sitting here. This is all the frowning, all the lines slowly goes away and relaxes. Take your hand, massage the back of your ear. Front of your ear, inside your ear, and the earlobe. This is called a auricular branch of vagus nerve. When auricular branch of vagus nerve is activated, you get a vagal nerve stimulation. Vagus nerve, 80% is afferent. That means it takes a signal to the brain. 20% comes out, called efferent. And yoga is totally based on the vagal activation. There's a lot of theories today, polyvagal theory, but if we have known for a long, long time, it's a vagus nerve. And vagus is activation of parasympathetic tone. Bring your hand, massage on the side of your neck. These are called carotid sinuses. We do the carotid sinus massage when you get a supraventricular tachycardia. When heart rate goes high up, massaging carotid sinus, the nerve supply is a little different. It goes through a glossopharyngeal nerve, but it is activation of your parasympathetic tone. It quiets down your cardiac system, cardiovascular system, nervous system. Take the hand, massage in the back of your neck, where the insertion of two muscles called the trapezius and the sternocleidomastoid muscle. Both are supplied by your cranial nerve, accessory nerve. So you are all quieting down your cranial nerves. Finally, at the end, when you put all of them together, so the people comes to me, oh, I don't have any time. I'm a physician, I'm a surgeon in the morning. It's fine. Get up in the morning. If you can sit down in the ground, it's fine. If not, stay in your wall. So how long? I said 5 to 10 breaths. They close their eyes, they're 5 to 10 breaths. Next thing they say, I was there about a minute. I didn't know. It is so relaxing. Then he said, I was there probably about a few minutes. I didn't know. Even you're operating. So when you're operating, you are bending down, doing this stuff, but consciously keep your back straight. I have a friend who's a dentist. He said, in my dentist, I said, yeah, consciously do it. How many time? Let's do it. Let's do a practice. Remember, the neck gets tightened up. So we got a neck relaxation. It's called a Brahma Mudra. There are 4 postures of the neck you do to relax your neck. In fact, when you are relaxing your back, when your spinal relaxation takes place, spinal relaxation will take care of your neck pain. Remember, the pain doesn't come from this herniated disc or a spinal stenosis. It is, yes, there is a herniated disc, there is spinal stenosis, but it causes irritation of a nerve. An irritation of a nerve called the muscle spasm. It's a tightness of the muscles which causes pain. Why? Because pain fibers are in the muscles, pain fibers are in the ligaments. Bone doesn't have a much pain fiber. Yes, they do. Bone marrow has some, periosteum has some. The people talks about cartilage. Oh, my knees are all gone, my cartilage is great. cartilage doesn't have any pain fiber. When the cartilage has gone, you get an inflammation, arthritis, body does a splinting. That's the body's way of protecting so that you don't have to move your joint too much to hurt. So the tightness of the ligament, tightness of the muscle causes pain. So the relaxation. So what I will do, let me show it to you what I'm going to do. Very simple way incorporate. Put your hand in the back, it's called a prayer pose to the back. Put your hand to the back. I think I've shown you so many times, I don't have to show it to you anymore, but you put your hand in the back, slowly, okay, let me put it here first so you'll understand what I'm talking about. Put your hands together. Doesn't matter where. Okay, I'm sitting a little bit close to the wall and in the chair. So, and then put your hands high up. And if you can see me now, I don't know how much you can see. I don't have too much of a space. Anyway, let me see. If you can see me somehow, this is my hand posture. This will be my hand, and I will be staying in this posture because I'm very comfortable. For you, you will be doing it as much as your body will allow without any pain. Then I'll sit down. Then what I will do, first I will do the 4 neck movement. This is called Paschim Namaskar, prayer pose to the back. And more you keep, remember, the Arambho is the beginning, Sthiti is the stability, and then it's called a relaxation, the Visarjan. Your hands will keep on going high up more and more. You'll incorporate the power of that bumblebee breathing. This is our last practice, because this practice incorporates the whole transformative power of yoga. Then we'll be doing the neck relaxation with the power of your bumblebee breathing. See, Bhramri Pranayama. Hands in the back, in a prayer pose to the back, Paschim Namaskar. Breathe out first. Slowly take a deep breath in and slowly drop your neck to the back. Breathing out with a sound of a Bhramri Pranayama or a bumblebee. So if you're doing it with me, you'll be noticing that your exhalation starts getting longer and longer when you do the bumblebee breathing. Bhramri Pranayama. Show you one more time. Breathe out first. You take a deep breath in, put your neck to the back, and breathe out with the sound of a bumblebee. Can't have any better practice than this. And when you do this, It doesn't take much time. There were 3 other postures. You go side to side, look all the way to the back without turning your shoulder, then rotate your neck from the left to the back to the right, then right to the back to the left. So I'm relaxed. My hand is going up again, a little bit more. It is in the middle. And again, see, this is the thing. Now I said, okay, I'm not discomfort in my hand. I come down. I listen to my body's signal. I don't compete with anybody. My breath is getting little effort. I back off. Breathe out first. Deep breath in. On the side. Other side. Look all the way to the back without turning your shoulder. See, my hand is still behind in my prayer pose to the back. Finally, slowly rotate your neck from the left to the back to the right and right to the back to the left. Drop your head down first. Then again, do a pumping and cupping. Keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hand, make a cup. Put it over your eyes. Let the eyes take all the heat from your hand. Relax all the cranial nerves, the muscles supplied by the cranial nerves, also the ciliary muscles, to increase the convexity of the lens. Massage your forehead muscles, which are all attached to the skin, all the face muscles attached to the skin. Massage to the back of the ear, front of the ear, inside the ear canal and the earlobe, which is supplied by the auricular branch of vagus nerve. Massage on both the sides, the carotid sinuses, to activate parasympathetic tone. Massage in the back, the insertion of the trapezius and sternomastoid muscle, supplied by the cranial nerve. See, I have been showing it to you with my button-down collar because I show these practices when I do it for the healthcare provider, physician, are sitting in an audience with their suit, tie on. I have also a suit, tie on, and I will do with the suit, tie on. I would give a rotation of my neck. I would do a prayer pose to the back, and all of them you can incorporate in your daily practice. So summarizing, transformative power of yoga. You are as young and as healthy as the flexibility of your spine, and keep the spine straight throughout the whole day during your activity and your practice. Activate the parasympathetic tone, and the best way to activate parasympathetic tone is exhalation longer than inhalation. Incorporate the mudras, the hand gestures to quieting your mind. Incorporate the pratyahara, the controlling your five senses by closing your eyes with the bumblebee breathing. Then create a vibration like a bumblebee, which have the same frequency as the power of brain to cancel harmonic resonance. Our rishis, we call our people who started the whole practices, they used to do it with the chanting, and the chanting has a same effect. Chanting has the same effect as the harmonic resonance. Thank you for joining this morning practice. This is a part of our CME. Our CME program starts within a half an hour. The people who are registered, they will join, and I will come back. This is about 11:05 our time. I will come back around 12 o'clock, and I'll be doing what is called the overview of yoga therapy for healthcare providers. And my presentation will be basically that the role of yoga in healthcare, or integrating yoga therapy in with Western medicine. Okay, so hopefully you got all these small minor points. And as I said all the time, this is our vast experience with the people. There's a lot of information on this video. Please, this will be all recorded. Watch it again, follow it up, practice accordingly, and you will see the transformative power of yoga. Karo Yog, Raho Nirog. Thank you for joining.